All right, diving in today, and we're tackling something pretty big, AIDS. We've got all this medical info laid out, and really what we want to do is, well, understand it, what AIDS is all about, how it messes with the body, and what that means for treating it.
Yeah, absolutely. I mean, at the heart of it, AIDS-acquired immunodeficiency syndrome, it's an infectious disease, right? And it all stems from this human immunodeficiency virus, HIV. It spreads mostly through sex and when blood's like directly shared.
Gotcha. So HIV is this retrovirus. It's like a virus that can kind of, inject its own code into our cells. And the really scary part is it goes after the immune system. Those T helper cells or CD4 cells and the tissues, like where the immune cells are, and it's kind of crazy. HIV can actually get into the central nervous system early on when you're infected.
Right, and a big red flag that HIV infection has become AIDS is when those CD4 cells, the count just plummets. Think of it like your body's got this army of, say, 1,500 of these cells. AIDS is when that number drops below 200 per cubic millimeter of blood. It's a huge hit to your defenses.
So HIV is like the attacker, and then AIDS is what happens when, well, the attack's really done some damage. Like your body can't fight off other infections anymore. Those opportunistic infections, the ones that wouldn't normally be a problem, right? And the sources, they list all these signs and symptoms that can show up when your immune system is like that weak.
Yeah, things like fevers that keep coming back, night sweats that like drench your clothes, diarrhea that just doesn't let up, and then there's this fungal infection called candidiasis. They're all signs your body's struggling to keep things under control.
Right. And there's also this like constant tiredness you can't explain and weight loss, and you might get skin rashes. Then there's some more specific things that can mean AIDS, like Kaposi's sarcoma, which is a type of cancer, and hairy leukopplakia, these white patches on the tongue. Oh, and the sources also talk about some oral is really bad gum infections, what they call NUP, necrotizing ulcerative gingivitis or periodontitis, and a red band along the gums, linear gingival erythema. So basically, if you've got these symptoms and they're not going away, you got to see a doctor.
Definitely, because early diagnosis and treatment, those are key. Now, when we think about medical treatment, especially for dentistry, the sources, they have some interesting points. Generally, people with HIV, they can usually still get routine dental care.
That's good to know. So it's not like an automatic, nope, can't see a dentist. But the sources do say there are times when you got to be careful. Routine dental work, it might be better to hold off if someone has, they call poorly controlled advanced AIDS. So that's people with like super weak immune system, really low counts of some white blood cells, neutropenia, or low platelets, thrombocytopenia, or even lung infections.
Exactly. And then with patients who have advanced AIDS, those with the CD4 count way down below 200, the guidelines get stricter. It becomes more about urgent care, dealing with pain and infections that are already there. And the sources say for any invasive dental procedure, you got to give antibiotics first, and the dentist should really talk to the patient's doctor.
So basically, someone with advanced AIDS needs a procedure that's, invasive, like pulling a tooth, and their CD4 count's under 200, or their neutrophil count, that's another measure of immune cells, if that's below 500, then they're probably going to get preventive antibiotics.
Right. And if someone with advanced AIDS has a really low platelet count, they might need a platelet transfusion before, like a tooth extraction or something. Helps stop too much bleeding, shows how important it is for healthcare providers to work together, especially with advanced HIV.
Okay, so just to sum things up, HIV is this virus. It attacks the immune system. If you don't manage it, it can turn into AIDS, especially when those important CD4 immune cells, when the count tanks. And that leaves your body open to all sorts of infections, and it means you have to be way more careful about medical treatments, even routine stuff at the dentist.
When you think about how HIV, it specifically targets and weakens your immune system, how you become so vulnerable to other illnesses, it really makes you wonder, doesn't it? Like how finely tuned and essential our body's defenses really are just to stay healthy.
Yeah, that's definitely something to think about. Really appreciate you taking this deep dive with us.